Tables and figures are an essential component of almost all operational research studies. And I'm going to try to take you through some of the key aspects of what you need to remember when you do your tables and figures. So this is almost everything you wanted to know. Why do we need to have tables and figures? Think around it. But the main reasons are that tables and figures provide a summary of your data or your results, and they allow a better visualization of that data or the results, and so that the reader can actually eyeball the data and the findings. And of course, it reduces text or word count, because if you look at journal guidelines, all articles have a limit in the word count, and tables and figures are actually not included in that word count. So if you put them in your text, you will have more words. If you want to reduce the text, then put them into tables and figures, and you will have less words. So once your analysis is complete, tables and figures help you to summarize the data and results for presentation to your readers. But then not all analysis warrants a table or a figure. Some simple results are best stated in a single sentence. For example, the incidence rates for loss to follow-up per 100 person years among those who paid for ART was 47, while among those who received this free of charge, this was 20, and that's the hazard ratio. Now, you could put this into a table, but it is not warranted. So, by definition, a table presents a list of numbers or text. It doesn't always have to be numbers, in columns, with each column having a title or label. A figure is simply a visual presentation of the results, and you have many different kinds of figures. The graphs are the most common. You might have flowcharts, maps, diagrams, photographs, and I'll try to give you some examples of these. What you need to keep in mind when you do a table or construct a table is to ensure that you've got all aspects of the anatomy covered in your table. So we'll go through each of these parts of the table. Now, the first is the table legend or title. It says Table 2, Treatment Outcomes for all patients started on antiretroviral treatment at hospital and health centers in Tiolo district, Malawi. That's the table legend. This is the column title. This is the table body or the data. This is the line demarcating the different parts of the table, and these are the footnotes. You will notice there are no vertical lines and only horizontal lines demarcating the column titles and the different parts of the table. So you need to get each of these in every table. Similarly, if you do a figure, you need to try to get the anatomy of the figure correct. This is 1A, trend in registered deaths at traditional authorities between 2000 to 2007 in Tiolo district, Malawi. This is the figure legend or title. This is the x-axis, the y-axis. The y-axis label, you have to have for each axis the labels. These are symbols. That's the x-axis label, the footnotes, and these are the different aspects that you need to have in every figure. Now, this is a simple way of presenting data. It's a simple table. It's the new TB cases per year in Malawi between 1985 to 2003. On the left side column, you have the year. And on the right side column, you have TB cases. And you will see as the years progress from 1985 to 2003, there is a considerable rise in notification of TB cases. In fact, a 5 times increase in notification. That's the message this table gives. But this is exactly the same data, showing exactly the same data, but it is much more expressive. It shows the trend. So whenever you're choosing your tables or figures, try to think carefully on what is the best table or kind of figure that will carry the message you want to convey to your audience in the best way possible. There's what we call the acid test for tables and figures, and you can perform this yourself. Basically, all tables and figures must be stand-alone and interpretable. This is the first aspect. And to be able to do that, it must be well labeled, and the legend should be descriptive enough to allow understanding by the reader without reading the results section. And then tables must be simple. You should strive for simplicity, because overcomplicated tables and figures are often ignored by the readers. Let me give you some examples. Here's the first example. Table 3, characteristics of pastoralists with TB placed on self-administered treatment in Ime, Ethiopia, May 2010 to March 2012. Now this title is pretty good. It tells you what the table is about, where does the data come from, and the period. And you have the variable on the left side, the different variables, and you have the number and percentages on the right. A simple, nice table that is easy to read and understand. Here's another table. Treatment outcomes at the end of the intensive phase and at the end of treatment, National Tuberculosis Institute, Kiev, Ukraine, 2006 to 2011. Now there's a mistake. It should be 2011, not 2001. But the table is quite easy to read. It's not clunked up. The person has rounded up the decimals for the percentage, and there are footnotes, and it's nicely done. Here's another example of a table. Now this does not have numbers, it has text. And some journals call this a table, others might call it a box. But tables can also have text, as I said earlier on. And these are the WHO definitions of TB treatment outcomes. Here's another table, and this is the Lancet style. The legend appears under the table, and it says examples of published studies on antiretroviral therapy based on routine program monitoring data in Malawi. And it gives you 4 different studies. It gives you the length of research and the activity costs. Now, this is not actually a very good title, because if you read this paper, the authors were trying to show that operational research can be published in relatively short periods of time with little amount of money if you piggyback that on their supervision visit. So the title should have captured that. If you read this alone, it is not standalone, so it could be improved, even if it was published. Here's a table, here's a box, milestones for operational research and capacity building programs in Europe, Africa, Asia, and the South Pacific from April 2009 to November 2012. It's a simple table or box. For the Tropical Medicine International Health, they prefer calling this a box, but it's again text. This is an example of a figure, and the title is Cumulative Incidence of Death Among HIV-Positive TB Patients During Anti-TB Treatment, Tiolo District, Malawi. Now, what is missing in the title is the period, and that's very important. Antiretroviral treatment, access for TB patients in the early 2000s is completely different from what it is now. So that might affect the death rate. So it would have been nicer to have the period. And if you look at this figure carefully, on the x-axis, you have the time in months in starting anti-TB treatment, and on the y-axis you have the proportion of deaths. Now you see most of those deaths occur in the first month, and then the curve sort of slopes off. Now, this was a very powerful way of showing what was happening in terms of death. And at the time we did this study, which was before 2010, WHO had recommended that antiretrovirals be started only after 2 months in TB patients, and by which time most of the deaths had already occurred. Now, this sort of observational data was useful to bring in the thinking that perhaps we need to start antiretrovirals much earlier. You could put this in a table, but the figure is more powerful. Here's another nice figure. It's the number of annually notified retreatment cases and annual number of sputum samples received by reference laboratories for culture and drug susceptibility testing in Tanzania, 2002 to 2010. Nice title. And you see in blue the notified retreatment cases, in red the samples received. So clearly you're getting much less samples than you should for every retreatment case, and this was a reflection of the problems in transport. So nice figure. Here's another kind of figure, and this is from Kenya. It shows basically changes associated with rickets. On the left side, the bulging of the distal radius. On the right side, what we call rickettric rosary associated with rickets. And here's another figure, which is a map of Guinea showing initial locations of the outbreak of Ebola virus disease. It's also a different kind of figure. And here, the area of the outbreak, the initial outbreak, is highlighted in red. And this is a flowchart, which is another kind of figure. This is very useful to show patient flow and losses to follow up. So this is really about patient flow and follow up at the Gitega Fistula Center, Burundi, April 2010 to December 2011. And as you go down the flow chart, you see people are lost to follow up, and you know, you can get follow up data for 3 months, 6 months, and so on and so forth. Those are some of the examples. Now we'll go to some examples where the tables and figures are not so good and we want to perform the acid test. So if you remember the acid test, where that first the legend should be standalone and descriptive enough to be able to understand the table without going back to the results section, and the data should be simple, and we should strive for simplicity. Now, if you read the title, it says Table 1, Timing of Interventions in each of the health zones. Doesn't say where, doesn't say when, so surely that is insufficient. And if you look at the data per se on the table, it is really not interesting. So should this pass or fail the acid test? It surely failed the acid test. Here's another example. Here's Table 1, Trends in Characteristics of Newly Diagnosed HIV-Infected Individuals registered for HIV care at antiretroviral therapy centers in Karnataka, India, 2004 to 2011. Now the title's nice, but if you look at the data per se, it's very difficult to eyeball this data. And that is because the formatting is poor. If you look at, for instance, the age groups, the number is on one row and the percentage is on another row. This doesn't help the eyeballing. The person has also used decimal places. Now, this sort of precision is probably not at all useful. If you went to look at female, for instance, under the first, under sex, it's 34.3. And I had said earlier on in my lecture on statistics that you need to think of if such precision is important. There is no 0.3 female, so obviously you could have rounded this up to 0 decimal places, and this table would probably have been better. Formatting is a key in terms of eyeballing. So the title's fine, but the data's not okay, so we won't pass this either. Now here's another figure. Well, here there's no title at all. And this was published in Human Resources for Health. And on the x-axis, you have the year. On the y-axis, you have FTE doctor. And one wonders what that is. Well, it means full-time equivalent. If you read the results section, you probably pick it up. But this is not standalone. It is not properly labeled. This fails the acid test. Here's another figure that was also published in one of the journals, relative contribution to GHQ score. The figure per se is simple to understand, but nobody knows what GHQ score is. So the title is not standalone. So clearly this one also fails the acid test. Now it gets even more complicated. Here's figure 1, final concept map, cluster map. It doesn't tell you where, it doesn't tell you what it's about, it doesn't tell you when. And then you have this pretty complicated picture with all kinds of numbers, probably very difficult to understand. This surely does not pass the acid test. And this was a related figure in the same journal paper. Bridge map comparing clusters on importance versus feasibility, very difficult to understand, and then the figures also very complicated, so probably failed the acid test. So those are some examples, but let me summarize the general rules about tables and figures. First, read the journal guidelines, because they have specific instructions on how your tables and figures should be done. You need to number the tables and figures consecutively as they appear in the text. So table 1, then table 2, then table 3, figure 1, figure 2, figure 3, and so on. They must be standalone and interpretable, and I've given you examples of exactly how this should be done. And for the tables, you need to avoid the vertical lines and use horizontal lines to separate only the main parts of the table. Should you use color or no color? Most often black and white is preferred, because if you fax the paper or if you send it to somebody and they print it out or photocopy, color is lost and you wouldn't be able to know the difference between the shadings. However, sometimes you do need color, and if you really feel you need color, then you will have to pay for that and ensure that you have a small budget for that. You need to place tables and figures usually on separate pages and always at the end of the manuscript, not within the manuscript, except if the journal guidelines tell you to do so. And it's best to prepare tables using the table function of Word. They must be cell-based, there's no tabs or hard returns. Now for the figures, you can use Excel, EpiInfo, EpiData, Stata or SPSS. But from my experience, the least troublesome, if you can, is to use Excel. Because if you use Excel, when it goes for copy editing and they want to enlarge the size of the font, they do it themselves. But if you do it on Stata, they'll ask you to, they'll send it back to you and ask you to do it. So if you're on holidays and you don't want to be disturbed, send your figures in Excel, and normally the journal handles this. Take a few minutes to read through this. The message here is that sometimes it takes you ages to collect your data, to do the analysis, but at the end of the day, the results might be presented in a very simple manner. And in operational research, be aware that sometimes you want to see your curves going up, others want to see it going down, but the reality might be quite different. The person on Wall Street on the left would like to see his stocks going up. The SP 500 is an indicator of that, is coming down. The environmental scientists want to see carbon dioxide emissions coming down. It may be going up, but you need to report the results as they truly are. Thank you very much.